Hello everybody. Today we have with us Dr. Vikram Barua Kaushik, Head of the Department of Urology Department at Manipal Hospital Gurugram. Welcome, sir.
Thank you.
Sir comes with the spanning experience of more than 20 plus years, with many lives being touched, many transplants being done, and today we are going to talk about just the symptoms of different varying urological problems that we face. We'll be just talking in a rapid fire form and we will just brief you what are the key symptoms available. Shall we start, sir?
Absolutely, please.
Perfect. So moving forward, the first question, what are the most common early signs in urological problems people usually face?
See, the most common urological symptoms that patients come to us with are increased urinary frequency, a sense of urgency to rush to the bathroom. Sometimes they have some blood in the urine, or they may also have a sense of incomplete voiding, that they have not emptied themselves out completely once they pass urine, or they may have flank pain on both the sides. These are the most common symptoms.
These are the common signs that we see. How can one differentiate between the general abdominal discomfort that somebody feels, like a gaseous feeling, and urological problems?
Normally, when you have a gaseous problem, the pain is in the upper abdomen, right? And whereas in a urological problem, it's in the flank which radiates down to the groin. It's a loin to groin sort of a pain that patients normally feel when it's because of a stone. But however, the best thing would be to do an ultrasound and find out what the exact cause is.
And are there any gender specific symptoms that somebody should be aware of, differentiating between male and female?
Not really. Normally, both genders have the similar symptoms. But yes, of course, an elderly gentleman with urinary frequency, urgency, difficulty in passing urine would be more related to a prostate problem, whereas a similar aged lady would have some other problem because of it. Yeah, so because there is no prostate in the lady.
And when should somebody be seeing a urologist if they are facing any urinary issues?
If you have any urological any urinary symptoms like frequency, urgency, difficulty in passing urine, sense of incomplete evacuation, or straining to pass urine, or blood in the urine, you must go and see your neighborhood urologist.
Okay. Yeah. And can lifestyle problems be a contributing factor?
Yes, sometimes. The most important thing is to avoid constipation.
Okay.
Yeah, so your diet should have a lot of fruits and vegetables, high fiber content, low fat diet, and plenty of fluids orally. These are the basic things that one should adhere to. Okay. And in the evening, if you're having a lot of frequency at night, cut down your fluid intake after about 6 o'clock or 7 o'clock in the evening.
Okay, and what could be the preventive measures, as you have mentioned few already? Yeah. But are there any other preventive measures like smoking, drinking, anything that they should avoid?
Of course. Smoking is an absolute no-no, especially for people who have a problem with their erections. Okay. Because it reduces the blood flow to the organ. Okay. So you may have erectile dysfunction with smoking. Infertility can increase with smoking, and smoking also increases the chances of bladder cancer.
I think that sums up beautifully what are the key symptoms, and many people would benefit out of that. Thank you for your time, sir.
Thank you.